SYCCE, ETWI, and Radiant Health Training. This is Stereo Career Conference 2024, Series 4, in episode 80. And yesterday we had a very good feedback from you guys, and I hope that you are super excited for yet more things to come. And first of all, I thank the Lord for making this opportunity and making us gather today. And I thank our CEO cum founder, Dr. Bharat Raj, for organizing this, and our organizing partner, Dr. Motishwaran, for this event. Let me start it with a quote. Trees give fruits not for itself. Flowers bloom not for itself. Sun shines not for itself. Nature is programmed in for giving for others. And especially this conference is all about giving knowledge and career guidance for us, the fellow Formians. And keeping this in our mind, let's irradiate and radiate the scopes and opportunities for Formd and shine in giving. So let's move on to the event. Before that, it's a kind request from you guys. Please make sure that your mic is muted. And I don't want to make it listed for the authors and the speakers. So kindly make sure your mic is muted. Let's dwell into the day one of this event. The first speaker, Dr. Mahendra Kumar, founder of CEO of Cleaners Research Solution, Bangalore. The theme that he is going to speak about is medical scribing unleashed and career insights. So before his time, let me introduce him to you. He is a dedicated and visionary CEO with a strong background in clinical research and a proven track record of leadership in healthcare industry. Demonstrated expertise in driving organizational youth, fostering innovation, and delivering exceptional results. Passionate about leveraging cutting edge research to improve patient outcomes in the advanced medical sciences. He completed his PharmD, Rajiv Gandhi University of Health Sciences. He did his clinical intern in Health Cloud AI. Being an assistant professor in KLE College of Pharmacy, Hubli, he moved on to the Pharmacovigilance Program of India coordinator in Indian Pharmacopoeia Commission. Then he worked as a clinical research associate in Sanjeevani Specialty Hospital and Heart Rate Control, Hubli. Project manager in Sanjeevani Specialty Hospital and Heart Care Center, Hubli. Then currently he is a founder and CEO of Cleanest Research Solution. He guided n number of projects and did 18 plus publications. So we are so much down to earth and privileged to have him on this event. So we welcome to this event and hope we'll find a very good informative session from you, sir. Please show your responses in the down below. And we welcome you, sir. The stage is yours.
Thank you, Malsi. Thank you for the brief and very short information about me.
Thank you,
So
sir.
I congratulate the entire RX Doctors team and also Dr. Bharat for organizing this particular event, which is very informative. I also attended a stress session, which was mind blowing. So, firstly, talking about the today's session. In the today's session, we are going to, we are going to dig more into the what is medical scribing, or how it has been evolved, and what is the relevance of today, and how you can grow your career when it comes to medical scribing. We also look into how we are entering as a medical scribing. So just give me a second. Let me share my screen. Please give me a confirmation, Melcy, if you can see my screen.
Yeah, sir, your screen is visible, sir.
Right, thank you. All right, so let's get started with the today's session, guys. So we are going to dig into the career insights, which is very relevant with the medical scribing. Now, as we all know, medical scribing is an integral part of a modern healthcare. It originated as a solution to the administrative burden faced by healthcare providers, particularly with the increasing adoption of your electronic health records, shortly known as your EHRs, and also your EMRs, electronic medical records. By allowing physicians to focus more on patient care and less on paperwork, medical scribes play a crucial role in enhancing the efficiency and also quality of healthcare services. Now let's get started with who is referred as a medical scribe. Now, a person or a professional, trained professional who provides a real-time documentation or an assistance to a healthcare provider or the physicians whenever a patient encounters during his visit. Now, what are the responsibilities? What does the medical scribe document during the process of scribing is? They're responsible for creating and maintaining the health records and also ensuring that whatever the data, whatever the conversation is happening between the physician and also with the patient, he has to document everything, and all the documented words or documents should be made accurate and in a comprehensive manner, be it with the medical history taken, symptoms, diagnosis, also what are the treatment plans the doctor has prescribed during the visit. Everything has to be documented by the medical scribe. What is the history of a medical scribing when it got started? Now, when it comes to the history of the medical scribing, or the earlier known as a medical transcription, from ancient time onwards, documentation has always a part of a medical treatment because doctors at the end need to write down their findings to research more and also aiming to resolve unprecedented medical challenges and situations. In other terms, or in other words, the documentation process is very, very vital when treating someone at every time in history and in every society. As you all are a healthcare professionals, you know what is the relevance of a patient medication history or a medical history whenever you're treating the person or whenever you're treating the patient, right? So the same emphasis was also given in the earlier phases. Also, error-free documentation was considered as fundamental in medical documentation since it can decide whether someone lives or dies, right? So based on that, from the ancient time onwards, the medical scribing has become a very important part. During the ancient time, we used to, the person who was acting as a medical scribe who used to record the patient history and patient related data on a paper or scrolls and or a clay tablets. Now when it comes to the pre-digital era, right, in before the digital age, before the advent of the technology into the healthcare, so the medical transcriptionist, right, the medical transcriptionist played a very vital role in documenting all these things. Now, what is the difference between a medical transcriptionist and medical scribe? Why do we refer them with a different name? We'll see when we go further. Okay. Now, the medical documentation has witnessed a revolution with the arrival of your EHRs or EMRs in the since 1960s. But we never paid much attention to them until the US Department of Health and Human Services, shortly known as your HHS, passed an amendment, passed a law called HIPAA. You might have heard of this particular word, HIPAA Act. So whenever you are starting something or whenever you're working as a medical scribe, it's very important that you follow the HIPAA guidelines and you abide on to them. Okay, it's very important following the HIPAA guidelines. It's known as Health Insurance Portability and Accountability Act, shortly known as HIPAA, HIPAA. Okay, now with the advent of when the US Department of Health and Human Services passed this particular act, now the medical transcription or a medical scribing was more into the light and everyone started practicing that. With the, before that, there are some hospital who do follow those scribing or documentation parts, but it was not a real time. It was followed with, in a clinic, maybe you were have accompanied by someone who can document everything. Now, this particular act, HIPAA Act, right? So this act implemented high level security and confidentiality while handling medical records. Now, one of the prime most guideline which says that when you are following, when you're documenting, when you are with the physician, when you are documenting whatever the conversation is happening between the physician and the patient, it should be kept confidential. Okay, it should not be kept in a public access because at the end the right to privacy is everyone's fundamental right. Right now, Now, with this particular HIPAA Act passed in 1996, which mostly emphasized on high-level security and confidentiality whenever you're handling medical records very specifically. Also, this particular act introduced prescribed penalties of those who did not follow these regulations. It's not that if you are not following the HIPAA guidelines, you will be not charged for anything, you will be not punished for anything. But this particular act came up with certain penalizations, certain regulations, which asked them to punish them if they are not following them. Right? It was a turning point for healthcare organization to shift to an EHS. That was just the beginning. It was in 1996, and it was just the beginning. Now, for the doctors, okay, for the doctors, all the notes needed to be typed into the EHR. It made their life very hard since it demanded most of their time before the system rather than caring for the patients, right? So during this period, many transcription companies came forward to assist medical expert with the documentation work. That's how the story of medical transcription has started. Now, when doctors were training medical students in their practice, they also used the students to generate notes on EHR while they cared for the patient. Now, this slowly developed into a regular practice, and doctors, and yeah, just give me a second, guys. Yeah, sorry. Yeah, so, am I audible? Can you please confirm someone?
Yeah, sir, you're
Yes,
audible,
sir.
sir.
All right. So what I was saying is this process, this practice of having someone to accompany them in the process of documentation, this slowly developed into a regular practice. And doctors and medical students found it mutually beneficial, which is learning from them. On the other hand, it was also helping the doctors to care for the patient. It slowly became a part-time job and opportunity for the medical students and also for the life science graduates. Along with that, in addition to the United States of America, which who passed HIPAA guidelines, many nations like Japan, Singapore, and Middle East, and the European countries insisted their citizen compulsorily to take insurance policy to handle their medical expenses. Unlike India, what we do, we go to the physician, right? So we pay them for the services which he or she has provided. But it's not the same case when it comes to the United States or the other countries, other few countries. What happens there is a insurance policy taken whenever a patient visits to the physician. The physician has to submit the document, and based on that document, the insurance amount or the insurance pay will be received to the doctor, right? Now, for an insurance claim to get approved, a doctor should submit a detailed medical record of the patient. Now, this report will contain details about the symptoms, what the patient is suffering from, the medical conditions, the medicines which the doctor has prescribed, or the previous medication history, and the total expenses related to the specific medical case. If you are, if there is any procedure done, if there is any minor pre-op done or a post-op, everything has to be documented, and that should be submitted to the insurance agency. Now, developing, evaluating, approving, or denying such a medical record is a very time consuming work. Now, that insurance companies and medical institutions consider most important. However, it is difficult for the in-house staff of insurance companies to handle such documents, right? Because it's at the end, what happens is the doctor is the alone one, a person who is sitting alone, who is also talking to the patient, who is also documenting everything on your system. At the end, let's assume this example. You are going to the doctor, and doctor, instead of speaking to you in a very good manner, he is more concentrated on yours, on the document which he has to develop, because at the end, whatever the document he or she submits is the one which gets him paid, not the if he is not developing a very accurate document, then the insurance company will deny it, then he won't get any pay, right? So in such cases, such as the advent of your medical scribing, now when these things started, when every country started applying onto the insurance policies as a main one, now everyone started having these persons as a medical scribes, or the earlier known as a medical transcriptionist. Now this is a brief onto how the medical scribing has started from ancient time to the digital age till today. Now, what are the responsibilities of a medical scribe? So when you're working as a medical scribe, what is the responsibility what are the roles you will be performing? Now, the first thing which you are primarily responsible with the documentation work. Now, the patient or there is a conversation happening between the patient and the physician or the provider. Now, you have to document everything. You have to sometimes you have to access you will be given with an access for the electronic health records or the medical records. You have to look into it. You have to get the previous data if at all it is accessible for you. Then you have to document everything as per the guidelines, as per the insurance company policies. Okay. And along with that, you have to document every conversation which is happening between between the doctor and the patient. Let's consider this. The patient is coming to you and then he is talking to you in a very generalized way. Let's consider this patient. Okay, the patient is having abdominal pain or some stomach issues. Okay, whereas unlike in India, the US people use the most of the proverbs whenever they are talking. So the patient comes to the doctor and patient says that the doctor, I'm having the butterflies in my stomach since 2 days. What is this butterflies in my stomach? So you should be able to convert those particular things into a medical terminologies. So you should be writing patient came with the complaints of abdominal pain or the stomach ache since 2 days. So this is where your medical knowledge or the medical terminologies will help you with. Okay, so the first responsibility of the medical scribe is you will be responsible in the documentation process, right from taking the patient history, his medication history, if he is having any vaccination related, or if he has undergone regular visits with his dentist, ophthalmologist. All such things has to be documented along with the conversation which is happening between the physician and also with respect to the patient. The next one is you can also, so this is the primary role you will be playing, that is with respect to the documentation. Other than that, you can also provide the secondary care, that is you can help them in the scheduling the appointment for that particular patient. When it comes to the referring mistake, you have visited the general medicine doctor and the general medicine doctor says that get an opinion from the ophthalmologist or get an opinion from the cardiologist. So in such cases, you can also help the patient in making the referrals and also appointments, and also you can coordinate with the other healthcare providers who can help this particular patient with. That's the secondary job or the secondary responsibility we can say. Other than that, we also have the other one, that's your clinical support. So wherein you can, if you have a good rapport with the provider or the physician which you're working, so they do accept your suggestions. So I was been working with one of the orthopedic doctor when I was working as a medical scribe. So the doctor was so close that used to ask me, so if you can make, if you can suggest anything which comes in your clinical pharmacy. So that kind of a relation, if you have that particular rapport, yes, you can work, you can implement the clinical pharmacy services also when you're working as a medical scribing. Okay, so those are the responsibilities of a medical scribe when you are working as a medical scribe. Now, other than that, the primary question which you should be asking me is, what is the qualification? So is the only people of the MBBS or the top and notch of the medical sciences can get into a medical scribe, or anyone? To be frank, I have seen a few of my colleagues who are from the engineering background, who are from the other background, but have a good medical knowledge with respect to the medical terminologies and everything, practicing or working as a medical scribe. Okay, so if you are from the medical, I mean medical life sciences or medical science, do I need to pause it here or can I continue?
Sorry, sir. Sorry for the response. You can continue, sir.
All right, thank you. Right, so if you want to be a medical scribe, firstly make sure that you have a good typing speed. Okay, at least 45 to 50 words per minute is very much needed when you're working as a medical scribe. For a transcriptionist, you can start with the 35 or 30 words per minute and then you can improve upon. But if you're working as a medical scribe, that's going to be a real time one and you have to document everything on real time. So if you have minimum of 50 to 55 words per minute is very good. Other than that, having the knowledge of the the medical knowledge, medical terminologies when it comes to the anatomy, when it comes to the clinical procedure, few of the clinical procedures is very important when you're working as a scribe. And also strong communication, so the communication is the key here. Okay, let's consider you could not able to understand whatever the conversation is happening between the physician or the provider on the patient, so you're going to fail there. Okay, the strong communication, especially having a few of the, I mean, some access to the US accent and all is going to help you a lot. And also the attentiveness and multitasking is a very important thing here. So why this attentiveness? As I said here, so when the patient comes to visit the doctor or a physician or a provider, now the patient will not explain as it is what is needed for your document. Okay, let's take an example. A patient comes to you and then he starts asking. So it's not that. So you are, I'm just giving an example how the chart will look like. Okay, so you're going to start with the basic chief complaint, and then you're going to talk about the relevant symptoms of why he is visiting today. And then you're going to talk about his medication history, medical history, and then is there any family history related, similar to what you practice in your day-to-day activities in your ward rounds and everything, but in a well comprehensive manner. Now, let's consider the patient has come to visit the doctor and he is here for a annual checkup. Okay, now in case of an annual checkup, the complete format is different. When the patient comes to an ER room, emergency room, the format is different. Now you have to differentiate what should be included and what should not be included. Now, most of the time, patients will not tell you directly what is he suffering from or what is the reason, what is the cause for the particular illness which he or she is suffering from now. Okay, in such cases, the physicians, normally the providers, will get in and then they start asking about their family things, their well-being and everything. So let's take the patient is in and the patient is very adamant onto sharing his let's consider his sexual life. Now the that particular sexual life is very important because there are symptoms which is relating to SIDs, okay, sexually transmitted diseases. Now, in such cases, having an information about those symptoms or the sexual life is very important. Now, if you directly ask the patient, what is your sexual life? Then most of the cases, patient in India, of course, he responds it very weird, but there are chances that 50% will ask him, will respond very good, and some people don't share. In such cases, you have to ask the multiple question. Now, you cannot record every multiple question which he asked. You should be knowing what is the intent of asking these many questions. Okay, so that comes when you are attentive towards the conversation happening between the physician or a provider and the patient. And multitasking, as I said, you should be, I mean, switching between the application, your EMR, if it is being provided, and if you have to give a referral, then you have to be switching between the application for the referrals and everything. Now these are the primary skills which you require. The first one is typing speed is very important. You should have a minimum of 50 to 60, you can consider at the early phase, and then if once you start working, you can keep on increase the words per minute. Okay, so that is very important. Then your medical knowledge, strong communications, attentiveness, and doing multitasking. So these are the skills which you need it when you are willing to work as a medical scribe, or when you are thinking of getting into a medical scribing profession. Now, once we know the skills required, so well, let's look into the career paths in medical scribing. So, in what all position I can work with? So, clinic, you can work directly with the healthcare providers. Okay, so the first job you should be starting with as a medical scribe or a clinical scribe, be it your junior or whatever. Okay, so from the trainee level, and once you complete at least in the clinical scribing level, what you will be doing is you will be accompanying with the doctor in his premise, and you will be documenting everything. Okay, and nowadays we have more remote scribe than the clinical scribe, because India is one of the biggest market, one of the biggest country which is providing scribes to the entire world. Now, other than that, you have a remote scribe. You will be doing the same work which we have discussed earlier, documenting. But in case of a remote scribe, you will be connected with the provider via one of the media which we use, be it your Teams, or there is we have a Google Lens, we have another EX and all. So those are the mediums which you can get connected on real time, and then you can scribe it. Okay. Now, once you get at least 1 to 2 years of experience, you are eligible for the position of team lead, and then you can go up to the level of scribe supervisor. Okay, you can shadow them other, and then you can look after, you can supervise the other people who are working with the providers directly. And also, you can work as a scribe educator. You can train the people who are interested in the medical scribing, or who are willing to go into the medical scribing profession. Or also you can train them, those who employees who are joining newly to the company. In such companies, you can work as a scribe educator. This is the career path, you have it. Now, the other question which you will be asking me is, what is the future of medical scribing in India? I'm going to answer at the end this particular question with the data which we have from the associates. Okay. Now, once we know the career paths, let's understand what's the difference between the medical transcription and medical scribing. Why do we call them with a two different names? So, as I said earlier, the medical transcription and medical scribing, the difference is only with respect to the real-time aspect. What used to happen with the medical transcription earlier is, so you will be, you as a medical transcriptionist, you will be getting the recorded document or recorded audio or a video. Now you will, based on the audio and video, you will be creating the document, and then you will be processing it for the quality, and then that will be going to the insurance department. Whereas with respect to the medical scribing is concerned, in medical transcription you have a option of going back and listening and then doing it. If you have done some mistake, you always have an option to listen that particular audio or video clip, and then you process, you complete the documentation. Whereas with the medical scribing, this is completely real time. Okay, so you will be documenting everything when the conversation is happening between the patient and the provider. You will be documenting on a software which is provided to you by the provider as per his convenience and company. Okay, and there is no go back and listen and come back. There is no that option. You have to document everything as real time when the conversation is happening. That's the reason I said attentiveness is the key skill which you should have when you're working as a medical scribing. So there's a basic difference between a medical transcription and medical scribing. Okay, so the key difference is with respect to the real time. Now, how does the typical work environment will be when you're working as a medical scribe? Now, if you're working as a medical scribe within the hospital infrastructure, then you will be accompanying the doctor or a provider in his office or in his clinic or in his infrastructure, and you will be documenting everything whenever the patient encounters, or you will be documenting everything as per the clinical workflow. But now we have the also we can also work in emergency departments and OPs. But now we have a remote scribes more oftenly in India, right? So many of the companies are working as a remote scribe. The provider will be in US or somewhere, and you will be scribing from them here. Okay, so for such cases you will be having access to particular softwares, and with that you will be given an access to the conversation happening between the subject and the provider. You can listen to that particular conversation and then document everything as per the notes. Now, so as I said, one of the information which you should be documenting is with respect to the medical terminations which you use more oftenly. So let's take an example. I have an example here. The patient comes and the patient says to the doctor that I feel sick to my stomach and my body is shaky and feels like it's hurting everywhere. Okay. Now you can uh,
బిర్యానీ ఎందుకు
I can
తెచ్చావు?
please move.
సాయంత్రం అన్ని తెచ్చా. ఎవరు?
All right. Can we take it further? All
Yeah,
right.
sir.
So, yeah. So as I said earlier, also in one of the one of the example I said, the patient will be coming to you and then he'll be speaking to the provider or a physician in a very generalized terms. So you cannot use those generalized terms, and you should be very specific about the medical terminology which he will be asking about. Now let's take, so the patient comes and then he says that oh, I feel sick through my stomach and my body is shaky and feels like it's hurting everywhere. Now this is the complaint given by the patient when he is visiting the doctor. Now how do you have to, as a scribe, you should be converting this particular content into a medical terminologies. Now, how you can write it? The patient reports feeling nauseous with associated generalized body ache and chills. Now, if you look here, there is no mention of nausea. There is no mention of, I mean, he often says that it hurts everywhere, but he don't say it's chills or ache. Now, this is where your attentiveness and your communication skills and your medical terminologies will help you. You cannot write the same word as the patient came to the outpatient department or emergency report with the complaints of he feels sick through my stomach, through his stomach, and his body is shaky and feels like it's hurting everywhere. You can't do that. You should be documenting in a very professional way with a full of a medical terminology. So you will be reporting so on. So let's consider the patient is a 80 years old patient who is male. You can say 80 years old male patient came to the emergency room with the complaints of, or with the chief complaints of the patient, or you can also say the with the chief complaints of feeling nauseous with is associated with generalized body ache or chills. Or also you can say uh, 80 years male patient came to the emergency room. The patient reports feeling nauseous with the associated and generalized body ache and chills. So this is one of the example. Then the patient in another example, he says that he got he comes to the doctor and then says, my pain got a little better when I took Tylenol at home. Okay. So what does this mean? You cannot, you should be converting. So here he is saying that the patient got, his symptoms got relieved when he used a medication Tylenol at home. So you can mention as a scribe, you will be writing it as his or her pain is mildly relieved after taking Tylenol. Okay, so this is the way you will be converting words into, I mean, the generalized words into a medical terminologies. Also, let's take the doctor is saying something to the patient in a very generalized way. The patient is not in a not well educated or not literate, so the physician will be saying it in a very generalized term. So the patient comes and he says that I have a running nose, and for that, so patients doctor says that you can try steam at home. Now for that you will be using technical terms advised steam inhalation in his prescription. Okay, so these are the some of the expectations when you're working as a scribe. You should be converting a generalized terms into very technical terms or medical terms when it comes to documentation as concerned. Now what is with the salary and job outlook for a medical scribe? So what is the trends happening now? There is also a data which says this, according to American College of Medical Scribe Specialist, which is shortly known as your ACMSS. The number of medical scribes employed in US hospitals and clinics has doubled annually since 2014. Okay, which says that the number of medical scribes employed in US hospitals and in the clinics of US has doubled annually since 2014. Now, this is where the competitiveness and the salaries, competitive salaries are present. Okay, now as far as I know, it's the medical scribes who are getting the highest paid salaries when as a, new freshers as well. Okay, so you can expect the median salary if you are in a US, you can expect up to the dollar of 36,000. And when it comes to the job growth, there is a 70, the expected job growth is 17% between 2020 to 2030. And the number of physicians, hospitals, and the healthcare providers are increasing day by day. Also, we have seen an advent the well of the AI and machine learning tools into the field of healthcare. This is also bringing extra growth as well. Right at the end, human touch is very important. The system cannot do or cannot frame the 100% documentation, right? So the human touch is very important. So that is where these expertise are coming in. Also, as we all know, India is a country that shares a time zone difference with the Western nations of one night, right? Which makes the country feasible for our around the clock outsourcing services. Also, one of the fact that India is rich with professionals who can manage technical documentation works, which makes India the favorite destination for outsourcing when it comes to the medical scribing. Okay, so when it comes to the salary aspects and medical scribe, there is a good pay the scribes are receiving. Even few of my friends who have been working with these medical scribes, they say that there is a lot of career growth, but the only disadvantage is you will be working as in the night shift. Sorry, so that's the only disadvantage. Whereas in the medical transcription, you have an access to documentation. You will be given with the window period of particular time period, and you will be doing it and sending it to the agencies. But when it comes to this particular scribing, the one fact is which is real time. You have to document everything on real time, and it's a night shift one. So other than that, yes, there's a pay is good, though you can see when it comes to the future aspects, yes, there is a future as well. So when you look into the market size, there's a study done by the as I said here earlier, so American College of Medical Scribe Specialist, they done it for the transcription. So in the year of between the 2020 to 2030, and when you see here, there is an expected rate of 5.5%, 5.8% of a CAGR within the 2023 to 2030, which makes the one of the highest market size for when it comes to the healthcare professionals as considered. Okay, so there is a future. And also when it comes to in India, there are a lot of hospitals who are now opting for the use of EHR, who are opting for the use of EMRs also. So slowly and steadily, we will also have these medical scribes present in the hospitals as well. In the metropolitan cities, I can see in few of the hospital where I'm also working, my team is working, they have already started with these sort of your medical scribes in their practice as well. So yes, there is a future as well, but of course there is an advantage, which is you have to work only in the night shift. So that's the only disadvantage you have. Other than that, it's a very good role. You have a career paths, you have a very a good medical, you can also work with the medical providers across the world, okay, with the different agencies. So that's also another advantage. Now when it comes to the training part and certification, so yes, it is very important. As I said, it's not that as soon as you graduate, you are eligible. So it's better you take some training or formal training program, some certification with respect to medical terminologies or the clinical documentations. And also, if you are okay with it, there are some countries which offers the certification exams as well. Okay, that is, you are certified medical scribe specialist, CMS, at CMSS exams are available for the US and all. If you are interested to get in there, and then you can opt for these exams, and then accordingly you can go for the higher ends of your medical scribing roles. Okay, so that's it. You have to know everything about the medical scribe, its origin, how it has evolved over a period of time, what is its scenarios from the beginning, right, from the ancient times to the digital age till today. What are the skills required? What are the, what are the qualifications you should have when when you should be, or you are willing to work as a medical scribe? And what is the options available for you, what is the market size and everything. So we have seen everything in detail. And if you guys have any queries, so let's get started. If you can ask the questions, you can use your hand raise option if it is any, or you can use your chat box, or you can directly pose it to me, the queries or the questions which you have. So thank you.
Thank you so much, sir. That was a crystal clear session.